Florence Nightingale is remembered as the founder of modern nursing. Born in 1820, she challenged societal expectations to pursue her calling in healthcare. At a time when nursing was considered a low-status profession, Nightingale envisioned a different future. She believed in rigorous training, compassionate care, and a scientific approach to healing. Nightingale's vision extended beyond tending to the sick. She understood the importance of sanitation, nutrition, and emotional well-being in the recovery process. Her tireless advocacy for improved hospital conditions and evidence-based practices revolutionized healthcare. The Crimean War, from 1853 to 1856, provided the backdrop for Nightingale's most famous work. When reports emerged of horrific conditions in British military hospitals, Nightingale answered the call to serve. In 1854, she led a team of 38 nurses to the Scutari barracks in Constantinople, which is modern-day Istanbul. The situation in Scutari was dire. Overcrowding, inadequate sanitation, and a lack of basic supplies had turned the hospital into a breeding ground for disease. Typhoid, cholera, and dysentery were rampant, claiming more lives than the fighting itself. Undeterred by the overwhelming challenges, Nightingale and her nurses immediately set to work. They cleaned the filthy wards, improved ventilation, and organized the distribution of food and supplies. Nightingale's commitment to her patients extended beyond her administrative duties. Every night she would walk the long corridors of the hospital, offering comfort and a sense of hope to the wounded soldiers. This compassionate act earned her the enduring nickname, the Lady with the Lamp. Word of her dedication spread, inspiring others to join her cause. Nightingale's impact during the Crimean War extended beyond immediate care. She recognized that poor sanitation was a major contributor to the high mortality rates. She implemented strict hygiene protocols, insisted on clean water and bedding, and advocated for proper sewage disposal. These measures, though considered radical at the time, proved highly effective. The mortality rate at the Scutari barracks plummeted from 42% to 2% within 6 months of her arrival. Nightingale's success in the Crimea demonstrated the life-saving power of hygiene and sanitation in healthcare settings. Section 5. The power of numbers. Nightingale as a statistician. Florence Nightingale's contributions to healthcare extended far beyond the bedside. She was a pioneer in the use of statistical analysis to improve healthcare outcomes. During the Crimean War, she meticulously collected data on mortality rates, causes of death, and the effectiveness of different treatments. She used this data to create innovative charts and graphs, visually representing the need for healthcare reform. Her groundbreaking work, presented in reports to the government, highlighted the preventable nature of many military deaths. This data-driven approach revolutionized the way healthcare was understood and administered. Section 6. Shaping the Future. The Nightingale Training School. Upon her return to England in 1856, Nightingale was hailed as a national heroine. Determined to capitalize on this newfound influence, she used her platform to advocate for improvements in civilian hospitals and the professionalization of nursing. In 1860, with funds raised through public subscription, she established the Nightingale Training School at St. Thomas's Hospital in London. This institution, the first secular nursing school in the world, emphasized rigorous training, a strong moral code, and a commitment to ongoing learning. Section 7, A Legacy Beyond the Battlefield. The Nightingale Training School became a model for nursing education worldwide. Graduates of the program, known as Nightingale Nurses, went on to establish hospitals and nursing schools across the globe. Their influence helped transform nursing from a largely untrained profession into a respected and essential part of the healthcare system. Nightingale's impact extended beyond nursing itself. Her tireless advocacy for improved sanitation, her groundbreaking use of statistics, and her unwavering belief in the importance of compassionate care left an enduring legacy on the world. Section 8. Nightingale's enduring impact. Although her later years were marked by illness, Nightingale never wavered in her dedication to healthcare reform. She continued to write extensively on nursing, hospital administration, and public health. Her writings, translated into numerous languages, influenced generations of healthcare professionals. Her legacy is evident in the countless lives saved through improved sanitation, the advancements in nursing education, and the continued emphasis on compassionate, evidence-based care. Florence Nightingale's vision of nursing as a respected and essential profession continues to inspire healthcare workers around the world. Section 9. Conclusion: A beacon for healthcare. Florence Nightingale's life and work serve as a beacon for healthcare professionals and advocates around the world. Her unwavering commitment to compassionate care, her pioneering use of statistics, and her tireless advocacy for improved sanitation revolutionized the way we think about healthcare. Her legacy extends beyond the countless lives saved through improved healthcare practices. It lives on in the countless individuals inspired by her unwavering dedication, her commitment to excellence, and her belief in the power of compassionate care to heal not just bodies, but also spirits.